Hey YouTube, it's Nata-Sleeve, aka Natalie, and this is my 9-week post-op video. I had vertical sleeve gastrectomy surgery on July 22nd, 2014, and it's now September 28th, so it's almost 9 weeks since I had my surgery. My highest weight was 310 pounds. When I went in for surgery, I weighed 287, and as of this week, my weight is 253. So I'm really excited because 250 is kind of like has always been my go-to goal at this heavy weight. I thought, well, I didn't think I'd ever be below 200, but I could probably get to 250, but every time I would try, I would lose 20 pounds and then gain 25. And anyway, 250 was when I started, I guess, kind of giving up on believing that I could still lose weight. So to be back at 250 and know that I'm not even close to being done losing is pretty cool. It's a good feeling. So that's something that I'm excited about. My clothes, I was a size 24 when I started. And I still have a pair of size 24 pants that I've been wearing, but they've been pretty baggy, and I've been wearing a belt with them, and I finally got rid of them this week, my heavy pants. So that was kind of an accomplishment as well. But even though I've lost almost 60 pounds since my heaviest weight in February, I'm still wearing size 22 pants comfortably, so I haven't lost like that many inches, at least not in my bottom half. My shirts are fitting more comfortably, and people say they can see it like in here, which I don't know. I have a hard time seeing that. But what I do notice is that I feel a lot better walking around, moving around. My ankles and my hips and my knees feel better. Even sleeping, like my back used to hurt all the time, and that's going away. So physically, I definitely feel better, and I'm able to do more exercise, which then will help me lose more weight. So all of that's good. Eating wise, I'm back to normal foods. I still try to limit my carbohydrates, but I had I've had bread here and there. I want to kind of get back to maybe having no carbohydrates at all, just because I think that increases the weight loss, makes it speed up. The protein shakes have been really hard for me. I think that they are gross, and I'm supposed to have like 80 grams of protein a day. I think I'm getting close to that with my food because I always have some kind of protein source, either milk, eggs, or meat at every meal, cheese. So I feel like I'm getting a lot of protein, but I've kind of gotten away from tracking, and I probably need to get back to tracking because then you know exactly what you're getting and what you're missing. But I haven't had any issues with food tolerance. I haven't thrown up at all. That's been really nice. I ate a cheeseburger from In-N-Out. If you guys are on the East Coast, you don't know what goodness In-N-Out is, but in the West we have them. But you can get the burger protein style, so it comes wrapped in lettuce instead of a bun. So I got one thinking it would be fine, and I did get a little bit of dumping syndrome from that. Not vomit, but the other end. And I think it's just because it had fake cheese on it and it was fatty, and so you learn what you can eat and what you can't. So for now, I'm going to stay away from hamburgers. If there are men watching this video, you might want to tune out right now because I'm going to talk about some girly stuff, some feminine issues. And that is, since my surgery on July 22nd, I have not had a cycle. And prior to my surgery, I was on birth control purely to regulate my cycles. I don't have a husband or kids or anything. I just was on birth control for hormonal issues. And I went off of it because it increases your risk of blood clots, which is a concern for surgery, but also because I thought when I lost weight, my hormones might regulate and I would start having periods again, but I haven't. I do have polycystic ovarian syndrome, so if any of you are familiar with that, you know that having an irregular cycle is pretty common. But it's been over 2 months, and I'm starting to kind of get nervous about that. But I know my hormones are changing, just because my skin um, is kind of freaking out. But that means that they're readjusting, hopefully. So that's the only bad news I have to report, though. Overall, I'm super happy. I feel so confident. Um, I feel like I can really do this. I know I still have a long way to go, and I know I could be doing better every day. There's like a list of 12 things that I could have done better, um, but I'm trying not to be too hard on myself, because I think that kind of attitude is how I gained all my weight in the first place, just giving up and being hard on myself. And so I'm really trying not to indulge in those kinds of thoughts, and just focus on the positive, like having pants that were too tight on me last year fit beautifully, and flying on an airplane, I didn't need my seatbelt extender anymore. Um, Saw an ex-boyfriend the other day, and I he didn't say anything, but I know he noticed the weight loss. So just stuff like that. But I got to keep focused on those things instead of the things that I'm doing wrong or could be doing better, um, and just keep moving forward. And so my next goal is to get under 200. I'd really like to, let's see, if I could do that by the new year. That's 3 months from now. 50 pounds in 3 months. That's probably not going to happen, but maybe let's say 225 by the new year. That's doable. I'll keep you guys updated on my progress, and I'll see you next week. Bye, everybody.